Welcome to Talking Man with the Bowtie Boy. I'm Tom Saviello behind this mask, and I have my good friend Trampas with me from Franklin Memorial Hospital. And so everybody that's watching, because of the mask mandate, we were given permission here at the university, since we're 6 feet apart, not to wear it, but we're going to wear it until that mask mandate is taken off. So Trampas, welcome to the show.
Thank you.
Franklin Memorial. So before I ask you this about you, I want to thank you, and because you have done what I think the president, or whatever exactly your title is at Farmington, is come out and be part of the community. And you've done that, whether it be the game feed we did for LEAP, or whether it's just having an adult beverage at a place or a restaurant locally. It's nice to see you as representing the hospital, because no matter, even if it's you at the individual, you still carry that with you, and it's much appreciated. People do notice that, so thank you.
Well, I appreciate that. I like to be integrated in the community, and it's something that's very important to me.
So tell us a little bit about you. How did you get this job? How did you be so foolish to come to Farmington, Maine, for goodness sake?
Well, I was actually, I'm a Colorado native, been in Colorado, fourth generation native of Colorado. My great-great-grandparents homesteaded in Colorado. And so, but, you know, I was happy with Colorado. I came out here to Maine and vacationed a few times and told myself, you know, if a job ever came across my desk that was in Maine, I would definitely take a look at it. And within 6 months of me making that internal decision, that sure enough, this job came across my desk, and I interviewed for it. And for my first interview, which I had 16 interviews, my first interview, I knew that this was a job for me. And so ever since then, it's been just wonderful. But I've got a long history of healthcare work. I started out as a CNA when I was 16.
No kidding.
Yeah, I was a radiology tech for 10 years. I was an anesthesia tech for several years. I worked in the cardiac cath lab, cardiac rehab, and I'm really getting in administration. I really didn't have it as a goal, but I just kind of happened by mistake, and ever since then I drank the Kool-Aid, and I really appreciate it. So.
Wow, so you have a pretty good medical background.
Yeah.
Did you get certified as a nurse, ultimately, registered nurse?
That's one thing I didn't do, is become a nurse or a doctor. So I wanted to be a physician at one point in time, but I figured out how much it cost to go to school, and I said, no, that's not for me. So.
Wow, that's pretty interesting background to have that kind of exposure to see. I mean, you literally, from the ground up, from seeing all the different types of medical procedures that could be done.
Yeah, I've definitely seen the insides and outs of the hospital.
So, yeah, you came to Franklin Memorial Hospital. You didn't think about COVID-19 at that point.
No, I didn't. During my interview process and leading up to the job, I had a 100-day plan, and it did not have a pandemic in that 100-day plan. So,
I can remember just as it started to hit, you were outside the store, you'd come in and done an ad at WKTJ, and the hospital was just about to turn the corner to get back to where it needed to be, and then this hit. So why don't we talk about the hospital in general? How's the hospital doing separate of COVID-19? Then we'll spend some time, real time, about COVID-19 and so forth.
Right. You know, the hospital is actually doing remarkably well, despite of the pandemic. You know, we did a lot of great things, and some people before me did a lot of great things to get us where we're at today. One of the biggest things that we did, we became a rural clinic designation, and that's just a different kind of reimbursement change, and that's made a huge amount of difference in our operations. But really, our volumes, our trust by the community and the patients, our patient experiences seem to be going up quite a bit. Particularly in the ER, we've done a lot of changes in the ER. We've moved to an all-physician model. And our recruitment's been phenomenal in the ER, and so a lot of those things have come a long ways, and we've done a wonderful job. Ironically, the months of summer and this fall, we've been turning a profit for the first time in probably 5 or 6 years.
Really?
Yeah. So despite the pandemic, we've been doing pretty well. Our first month of the fiscal year of October, we've had an increase of $3 million in total charges over our budgeted total charges. So the people in the community is starting to come back and have a lot of trust in us.
Go back to, what is a physician-based ER? So what exactly is that?
So a lot of smaller hospitals, in order to help expenses stay low, they sometimes have nurse practitioners or physician assistants in the ER. And so we made the commitment to have the highest level of care by having all physicians in the ER rather than APPs, which APPs do a wonderful job, but we heard from the community about a year or so ago that this is what the community wanted, and so we heard that, and so we decided that we'd make the commitment to have all physicians in the ER.
Now, I know there's been discussion in the past of urgent care, and we know that in the bigger cities that's happened, but that doesn't quite fit, that model doesn't fit us well up here.
So we're kind of what I call a donut hole, where we're kind of big enough for urgent care, but we're not quite big enough for one. Urgent cares require a lot of volume to become sustainable. It's definitely a need in the community, and we've recognized that. And so in our strategic plan for the next 3 years, we're taking a look at what does that look like. It may not be an urgent care, but is it expanding our clinics to where the hours, after hours, during the weekends, or is it having more of a clinic-type relationship where people can go to get their acute care needs met rather than going to the more expensive ER?
It's just interesting because I always thought that would work, but I understand the population. I understand what you've said. But it's like last week I stepped on a nail 2 weeks ago, and it was like it was a little bit red, and I'd already done, I had my tetanus shot. I had it years before, and got to the point that I said, well, I think I got to go to the emergency room now. Interestingly enough, because I'm with Aetna with a main care or whatever it is, the senior care, I called the nurse practitioner online, and she actually said, well, does your physician have a phone number? Well, I never thought of that. I said, on the weekend, they're not there. So I called, sure enough, my physician called me back, and I said, I probably need a prescription for an antibiotic, and if it continues to bother me, I did. So I never went to the emergency room. I was able to take care of it without doing that, which was a tool that I think is available through your group.
Yes, it is. All of our clinic practices, our primary care practices are on call after hours. And so it is an option to call that practice, and then the clinician, the doctor who on call will get back to you in that. So that's part of the plan also. But we also want to have it where we can, if somebody really needs to be seen and not necessarily need to be seen in the ER, but it's really expensive, we want to provide that care also. So
COVID-19 hits, and so we can start at the beginning and then work up to where we are. How did the hospital actually stop taking all patients at that point in time other than emergencies?
So kind of a combination of both. It was about middle of March. So we're part of Maine Health, and so which is probably one of the best things that the board of directors here in Franklin did, to become part of Maine Health throughout this pandemic. It was, nobody knew it was coming, right? So, but in the middle of March, we really started focusing on what do we need to do, and how do we need to run as a healthcare organization, not knowing what the COVID-19 is going to bring, and how do we combat that. And so we really relied on what's called a flu surge planning. And so flu and COVID-19 are alike, but not alike in a lot of different ways. So it really said that we need to start pulling back on all elective surgeries, all elective procedures. One thing it didn't say is move away from in-person visits at the clinics. And so that's something that we had to kind of devise as we went along. But we moved back on all of those things, and then we started doing telehealth visits through the clinic, which was something that we've been trying to do for quite some time, and it sped up quite a bit. And then we moved back on all of the procedures in the surgical areas, in the outpatient areas, physical therapy. We shut everything down. One of the things that we did at Maine Health and here locally, we made the commitment at that point in time that we're going to pay all of our employees throughout this pandemic, whether they're working or not. So we made the commitment to our employees to say, you matter to us, and we want to make sure that you're well compensated as we go through this. And so as the pandemic kind of progressed, we started figuring out ways to get PPE in, to get testing put into place. We have a lab with Maine Health called Nordex. They're very instrumental in this pandemic and making sure we can get our patients and community tested rapidly and get those test results back quickly. And then we got a whole lot of PPE in. At one point, we really thought we were going to be low on PPE, but we had other organizations step in, such as Origin USA. They made us 7,500 face shields for our employees, and we actually spread those out across Maine Health. New Balance Shoe Factory down in Norway, they provided 500 pairs of shoes for our frontline workers. And also LL Bean actually stepped up to the plate, and they were able to source us almost over 1.5 million of surgical masks.
Wow.
During this. And so we've really relied on that partnership not only in the communities, but in the region of the state. And so that's something that's been very special and important to us to help.
And it's interesting, I'm glad you told us, because I don't think anybody knew that.
Yeah.
I mean, I knew Urgent made their masks, but I didn't know that they worked with you at the hospital to get you by. And I didn't know that LL Bean stepped up and found masks out there. So that's pretty significant for those businesses to really take care of Maine people.
Right, right. And then the same thing with N95, which is an important mask for taking care of patients that we know have COVID. So that's been pretty significant. And right now we're sitting really, really good on that, on those supplies. During this, we also brought in a technology of ultraviolet radiation, where we can put N95s through this technology and repurpose them, and so essentially sterilize them. And so if we were to start running low on those, we could start doing this, and we can put those back into service and still have that. So as far as PPE goes, in the processes, we've learned a lot. With Maine Medical Center being part of Maine Health, we really learned a lot from a research perspective, such as the drugs that we can use here locally and take care of patients more than we anticipated. Moving throughout this summer, as we saw the pandemic kind of slow to a crawl here in Franklin and Farmington and across the state, we started kind of dialing back into those normal operations, bringing back in patients and their care, and started learning a whole lot of things that we know now, what we can't do and what worked really well. And so some of those things that we're really concerned about at this point in time is that patients who were delaying care during the pandemic actually became out much more sick than what they were before, and so that's something that's concerning to us. Behavioral health, mental health patients. Right now, 50% of our ER volume is mental health, behavioral health related issues, and sometimes it takes up to 5 weeks to get them out of ER to go get them to the level of care they need at a mental health hospital, behavioral health hospital.
So the isolation and the threat of the disease has really had an impact on people, not so much the disease itself, but the fact that they're dealing psychologically with what it's done to them. It's really had an impact.
Yeah, absolutely. It's something some of my primary care providers are really concerned about, is how do we keep the patients healthy and not go through that again, because they're just now getting most of them back to the health they were before the pandemic.
Wow. And when you say the delay in medical care, it's over COVID, not so. I think about, well, October doesn't surprise me that you saw more people come back, because they had delayed everything for such a long period of time to come in and get whatever knee replacement or whatever they're going to get done. But it's more COVID. People get the symptoms and then just stay home until it really gets bad.
Correct. And there's a level of fear also of going to a hospital and actually getting the COVID that's keeping people away also.
I hadn't thought about that. I mean, the ultimate fear I have is knowing a little bit about ventilators. Is when you put someone on a ventilator, it's going to have a tough time coming off of that ventilator.
Right.
So now, as it surged back in again, what's going on? I mean, did you guys expect to see that, and how did you prepare for it?
Right. So back in beginning of August, it's something that we all started preparing for, knowing that it was going to start surging up, and just like with the flu, we have that. The cooler weather bring people closer and indoors, and it's people get more sick, and so. Right now, we have a surge plan across the Maine Health, and where Maine Medical Center and some of the larger institutions that have a lot of experience in taking care of really sick COVID patients. Our goal is, if we have any of those patients in our hospital, we'll send our patients down to one of those facilities. And so it's really, we're focusing on those areas. And so in those areas, we'll start dialing back some of those elective procedures as needed. So depending on how many patients they have, different things like that. And so then those patients can come back to our communities and recuperate once they kind of got past that sicker stage. So we'll start focusing more on the telehealth. We have it now separated. We have what's called an acute care clinic. And so if we have any suspected symptoms or anything like that with patients, we'll send them to the acute care clinic to keep them out of our main facilities, to keep all of that kind of clean, if you will. We also have a robust drive-up testing center for COVID also, that anybody can come and get a testing done.
So let's just go to the testing part and then go back to some of the others. So if I wanted to get a test today, I could just show up, or should I call the lab and make an appointment?
So you should call the hospital, the outpatient hospital clinic number, and you can get an appointment done there. It's most likely the best way to do that.
So that if we put the phone number up, they could call the general number you gave and ask for the clinic. So why don't we put the number up if we could? That would be great. It's right here, Trampas. Can you see it? It says 778-2264, and they can then ask to be connected to the lab, and then they'll make an appointment for you to come over.
Correct.
And how have you? A lot of people been coming in to be tested, or is it?
Yeah, so usually around August, we were having about 30 to 40 a day. And now in the past couple of weeks, we've been having about 100 to 150 a day. So it's been quite a bit, our numbers have gone up, but also our positive numbers have gone up, but so has our testing as well. But so, yeah, we also have a whole lot of other things going too. In order to have a surgical procedure or some sort of a procedure done, they have to have tests also. So they're not mixed in with all of the patients. We have a certain time slots for the pre-op, as we call them. But yeah, we have about 100, 150, depending on the day of the week.
Wow, that's quite a bit. And I know people have had them. I mean, I had the test. It's quite an interesting swab that they use. That I think they got up to what little brain I have all the way up here. It felt like it.
Yeah, we'll try not to take it all.
And there are different kinds of tests. There's a rapid test, there's the antibody test, there's the COVID. Which test are you guys using?
So we use the PCR molecular test, and that's the swabbing test. It's the most accurate test at this point in time. With our main health labs, so we have a couple of ways of doing it. So we have main health labs. If you're one of our patients, we'll send it to the main health lab, and we usually get results within 24 hours. We also have the state swab and send, and we'll do that, and then we'll send it to the state lab, and it has about 2 to 3, sometimes 5 days, just depending on how busy things are, turnaround time. But molecular PCR swabbing is what we do. The antigen test is kind of, it's an interesting test. It's not really a diagnostic at this point in time, but it's getting better. And there's a rapid test out there that will tell you if you're negative or positive within a few minutes. The only challenge with that test is that it's good if you're negative, but if you are positive, there's a lot of false positives, and so then we recommend you to get the PCR test done.
So the testing, they actually go in and swab it, send it off campus to be analyzed and get your results back. So you've obviously had an increase in the testing, and I would imagine as a result of that, you've also got an increase in positives that come back in again. If I got tested positive, but I show no symptoms, how does the hospital then advise me or what would I be advised to do? Mm-hmm.
Yeah, so at that point in time, if you're a hospital patient, then your physician would call you, or two things may happen. The medical director of our own lab would call you, and then a physician would call you and then give you the instructions on what you need to do. And usually that's isolation, monitor your symptoms and different things like that. And then they'll call and check on you throughout your, when you're infected, to see how you're doing. And if you need a higher level of care, we can get that for you.
It's interesting, this summer, when you and I talked about testing, I had every symptom except for fever. I had no taste, I was lethargic, I felt like I had a fever, I could feel chills and everything, but I checked my temperature, nothing. I had no sense of taste, and just think, okay, I must have a mild case of it, but when we got tested, nothing was there. Mm-hmm. So it was just a really weird period of time, like 5 days, and I lost weight, I couldn't eat. Mm-hmm. But I can't imagine having this disease. People don't realize what this disease can do. Mm-hmm. There was a gentleman who used to be on Angus King's staff, Dennis Bailey. He was in Washington and had the disease, and he blogged every day about what it was like. And it was almost, I mean, he was like within hours of being put on a ventilator because they couldn't get his oxygen levels up. And if anybody wants to understand, you go on Facebook and find Dennis's blog. You'll know why you wear a mask. Let's just put it that way. It's pretty dramatic, and for somebody like me who's a young 70, it's something I'm concerned about. Mm-hmm.
Yeah, it's definitely not no joke, and it should be taken very, very seriously. Even in the mild cases, it should be taken very seriously, because you never know when that mild case can turn into something more serious for somebody else.
And if I did get diagnosed with it, you're not going to start a drug regime with me right away. You're going to wait until I show us a little bit more symptoms. So what would be the drug? I mean, we know what the president went through, and obviously it had an effect. What would your measurement be if I did start to show more symptoms and had trouble breathing and so forth?
Mm-hmm. Right. So what would that look like then is, so most likely if you need a higher level of care, so we'd definitely admit you into the hospital here locally. And there would be some drug regimens such as some steroids and some different things like that, depending on what you have going on, and see what the response is to that. And if the symptoms progress to be worse, then we would go ahead and either make the decision to transfer to one of the bigger medical centers where they have all of the drugs right now, the remdesivir, the monoclonal drugs, all of the steroids, and they're also doing a lot of trials in those areas also. And so that's what it would look like at that point in time.
Wow. So you're physically, if I had it and I really started to progress, you would ship me out, is that in what you said
Right.
earlier?
Right.
So you're going to deal with more of the mild cases that are here. And so do we have, is it that, because I know you can't reach patient confidentiality, but is our ICU being used for COVID up here now? Or?
So we were able to use the ICU unit for COVID, and most of the patients haven't really here locally haven't required that higher level of ICU care here locally. So at this point in time, we've not sent anybody.
Oh, that's good.
Yeah.
So, but if somebody does have that, most likely you'd be trying to ship them out because they obviously never need another level of care that's there.
Correct.
Wow, it's fascinating because what I understand too is that some of the drug regimens they started with were treating it as if it was flu and they really didn't do anything.
Mm-hmm. Correct.
So,
wow.
Yeah,
now the drugs right now that we have has been, I wouldn't say super effective, but they've been a lot more effective than doing nothing. And so, yeah, we have a lot of good results with it also.
So we have this prediction of the vaccine. It's coming end of November. How are you guys gearing up to plan to issue those, and how, I know the first persons who need to get it are ambulance drivers, medical personnel, because they're the people that are taking care of me if I show up. But how are you planning to administer that?
Correct. Yeah, so yeah, we've been working since middle of September on operationalizing the COVID vaccination. And so understanding that there's a lot of nuances with some of the vaccines compared to others. So we have a team put together to give those to our own care team members here locally, and then also when the time comes to give those to the community. So at this point in time, we've had a good resource in Dora Mills, Dr. Dora Mills, who's also the governor's sister. She's the Chief Improvement Officer, Health Improvement Officer for Maine Health. And she's been giving us guidance on what to do across the system. And so we have all the documentation in place, ready to go, all of the processes in place. Now we're just waiting for that vaccine to arrive, and we hope to have it in the next 4 to 5 weeks.
Well, do you have the temperature freezer that you can put them in to keep them cold?
We have ways of doing that, and so we're not overly concerned about that as we thought we would be.
No, that's interesting, because that was what I thought was going to be the biggest hang-up, is where do you find something as cold as that to maintain it? And it's a two-shot, the new one, the one Pfizer's put out is a two-shot regime, if I understand correctly.
Correct.
How soon after do you get the second shot?
So don't quote me on this, but I believe it's 21 to 28 days, something around that range. So
you're actually hoping to have some of the vaccine in here by December, by Christmas.
Yeah, that would be the best case scenario.
Do you know have any idea how they allocate the number of things that are coming out, the number of shots that will be sent out to Farmington? Or are they just working on that?
So I know that there is I call it a magical formula that the state gets so many, and I believe the last I saw that it was a big range of 40,000 to 150,000 first round doses to the state, and that's the last figure I saw.
So it's going to start. So the hope then, but maybe by the end of the springtime, pretty much everybody will have been immunized. Hopefully, so we can go back on to not wearing these suckers anymore. Wow. So COVID comes to an end. What else is going to happen at the hospital? I mean, this is trial by fire, Trampas. I mean,
right. Yeah, that's how I learned best. So actually, we have a 3-year strategic plan. We wrapped up during COVID, and we have a lot of great things we're doing, and we'll be doing. And so we're really focused on the growth of our service lines and then implementing new service lines also. I kind of call it going back to where we used to be. We used to be a real regional powerhouse in 2008, 2009. Really get back to those glory days, if you will. But we have a lot of recruitment going on. In fact, we had 14 physician openings this past summer, and now we're down to about 3 or 4.
Wow, that's great.
Yeah, so that's some of our biggest focus is looking at orthopedic surgery. Have some great candidates we're taking a look at, and hopefully get that going again. growing our specialty services, and so things that we don't have, such as endocrinology, different things like that. We know we can't support full-time endocrinologist or whatever that specialist is, but being part of Maine Health, we do have that availability come up on a rotational basis. And then really focusing on the patient experience. We know that healthcare is very difficult to navigate. When I go through as a patient, I'm just flabbergasted. I can run a hospital, but I can't, run my own healthcare, and I can't imagine what it's like for patients. So we want to make sure it's the best experience possible, and so really focused around that. And then also making sure our culture is the best it can be, because we can try to do all of those other things, but if our culture as an organization isn't good, then we'll fail. And so we have a really good culture here at Franklin Memorial Hospital and Franklin Community Health Network, and we'll continue to work on that. And I believe we're going to be the best hospital in the state.
I'm not surprised. I mean, so I know some of the docs pretty well that are here, and some of the nurses, they are truly outstanding. And they're parts of the community too. I mean, that's one thing that's neat about the hospital. The doctors and nurses you have are part of us. They've come here because they want to live in Maine, and they want to stay in Maine, and they love the local community and local flavor that's here. So it's pretty neat. Yeah. My good buddy, Dr. Gunther, I go to see him at least once every 3 years. He gives me a certificate. I'll have to tell you about that sometime.
I'd love to hear that.
So, Trampas, where are you living? Here in Farmington?
Yeah, I live outside of Farmington, just in between Farmington and Industry. So I bought a house a couple of months ago, and so love my little slice of heaven, as I call it, and so nice and peaceful and beautiful, and so that's where I'm at right now.
Well, let's put the phone number up one more time as we get close to an end here, so people can get in touch with the hospital if they've got any questions. It's 778-2264, and this is, the hospital. When we moved here, we chose this area specifically because of Franklin Memorial Hospital, because unfortunately, as a kid, I was known to visit the hospital a lot and knew how important it is to have something close by. And as I said, the docs that have been here, I've worked with them since I've walked in the door prior to my political career, and know how they worked with my family in a crisis, and how they worked us through it and guided us through it, and how the hospital treated us. So you've got a supporter in me with what you do. And I'm glad to see somebody like yourself come on that's really enthusiastic about the community. One who's been known to show up at Ambition Beer to have a beer, or to show up at Tux or someplace else. But that's important for people to see somebody like you, because then you're approachable. And then if somebody have a question, I'm not, as you know, I'm not afraid to send you an email. I don't need all the garbage in between. I just go right to the big guy and find out what's going on. And you've been truly responsive to that, and it's much appreciated.
Yeah, it's very important. Any leader of an organization, especially healthcare leaders, to be responsive and be out in the community and understand the community and build the organization towards that. So you're on for the first time with my show. Will you come back? I will come back as many times as you ask me. I think it'd be great, because sometimes we should talk about the Maine Health connection, because I don't think that really happened, and COVID kind of hit, and so people have lost sight of what's gone on with that and how that really helps us in the long run about keeping our hospital, number one, but also the services that we have. And then I offer to you, if you have some people that would like to come on and talk about certain issues, we'd love to have them come on. Yep, definitely. I'd be happy to do that. Trampas, this is great. I really do appreciate it. Thanks. Thank you. Appreciate it. Be safe, and tell the hospital that we really appreciate and enjoy them. This is Tom Saviello. Thanks for tuning in to the Bowtie Boy. We'll see you next time.